Good afternoon, folks. Executive Al Mattingly here. We're having our weekly COVID update. I thought that it would be nice if we brought back two of our old regulars, Clay Horton from the Daviess County Health Department and Dr. DuFrayne from Owensboro Health to talk about all things COVID. Before we get into that, I'm going to give just a little bit of an update. Right now in Daviess County, we have 3 folks hospitalized, which is really great. I show 176 folks who have passed away from COVID. Let's just take a moment and remember those folks and remember their families and friends. Thank you. We've had 10,300 cases confirmed in Daviess County. The age range, they range anywhere from less than a year old to 80 plus. I think we even had, and Clay can answer later, we even had someone who was 100 years old or older than 100 who recovered from COVID. On the screen, you're going to see the community update, 18 new cases today. And it kind of spells out what I just gave you. See the 3 W's over there: wear a mask, wash your hands, watch your distance. Absolutely as valid admonition today as it was a year ago. Those are 3 of the tools that we have in the toolbox, and now we have 3 other tools in our toolbox, and they're called the vaccines that we have: Moderna and Johnson & Johnson and Pfizer. And we're going to get into that in a little bit. I assume, Jordan, you've got a picture of the state. Let's see if he does. Back at the beginning, there we go. Back at the beginning of the month, we had actually gotten into the yellow. We were down to around 9.4 cases per 100,000. You'll now see Daviess County in that upper kind of left-hand quadrant. We're at 13.4 cases per 100,000. That's a little higher than the state's overall incident rate, which is 10.42 per 100,000. And we're going to talk to Clay about why are we where we are today after we were doing so good earlier. You'll notice around us, Henderson, Webster, Hopkins, Muhlenberg, Butler, Breckenridge, all those counties have been in and out of the yellow. A lot of the counties that you see that are in the green are very small counties, smaller populations, and it doesn't take but 1 or 2 cases for them to get in, and you delay a day or 2 or have 0 and they'll get right back out. So I think what we'll do, Jordan, I don't believe we have anything else on there. Do we have the CDC? There we go. This is according to CDC, people vaccinated, fully vaccinated, total 30,646. As a percentage of our total population in Daviess County, that's 30.2. But you've got to take out those who are 18 years old or less. So we're doing really good. We've got 40% of our population vaccinated. And the people I'm really proud of is 69% of our senior population, those who are 65 years of age or older, have received their vaccination. We're doing great. We can do better, and we're going to talk a little bit about how we do better as a community. So, Jordan, take all that stuff off, and now here we go. We have the experts. So, Clay, I'm going to start with you. How's the county faring in terms of new COVID cases?
Well, we're holding pretty steady, and we've been steady for about 2 months now. You referenced back in April, early April, we dipped down into the yellow. I think that was a result of a lot of folks were at spring break and maybe not getting tested. But you know, with the exception of that week, we've been averaging kind of the mid-teens in Daviess County as far as a daily number of cases. We've been pretty steady between about 25 and 30 cases for the district. So, you know, I wish it was lower, but considering where we were back in the winter, you know, we're at a lot better place than we were. And I think a lot of it probably has to do with our vaccine rates. a lot of folks getting vaccinated. The challenges around vaccines have a lot of those have been worked through in terms of supply. There's plenty of vaccine in the community now. Everyone who's eligible to get vaccinated has that opportunity.
Well, Clay, do you think, back when we had the flu, and that's something that we've been fortunate not to have to talk about because there's been very little regular flu in our community. When summer months came along, the flu seemed to disappear. And we all thought last year that was going to happen to COVID. Is that going to happen to COVID this year?
Now, I think we pretty much know that there's not a seasonal fluctuation with COVID. I think we all had that. We were optimistically hoping for that this time last year, but we didn't see that. We have to do the same things in the summertime that we have to do rest of the year in terms of using all of our tools, wearing our masks, keeping our distance, and washing our hands.
Well, Clay, if I forget, I want to talk a little bit about some of the changes that were announced by the governor early on about wearing a mask if you're fully vaccinated and size of the group. But I want to ask Dr. DuFrayne. So a couple of weeks ago, Johnson & Johnson, we had a little bit of news and it scared some people. And the Johnson & Johnson vaccine use was halted for a while. How has that resolved itself?
So the CDC, CMS, and the FDA all decided to pause using J&J until we straightened this out. Honestly, the numbers were so low that those organizations actually got a lot of pushback and a lot of criticism because they thought it was an overreach or an overreaction. But since this is a relatively new for COVID, though the technique is not all that new, it's been around for a couple of decades, the messenger RNA vaccines, they just wanted to be very cautious. So they paused, they really looked into it. So far, we know we've identified 15 cases, 13 of cases are in women less than 49, 2 cases were in women who were in their 50s. And it comes down, we don't know why they get it. It actually mirrors a condition that is well known in medicine where your platelets go low and you form blood clots at the same time. And this really kind of mirrors that, and we don't know what the mechanism is. But when you really look at the numbers, 7 cases per million people vaccinated, 7, that's the total number. If you look at 50 and above, it's 0.9. Yeah. So the numbers are incredibly low. And knowing all that and looking into it, last Friday, we were given permission to use the vaccine again.
Okay, good. Well, while I've got you on here, I just want to ask you, come clean. Tell me what the medical field is hiding. What are you not telling us about these vaccines and all the issues that I see on Facebook, right. all the anecdotal instances of people who are taking the vaccine and dropping dead in 2 days, who are taking the vaccine and become infertile or impotent. What in the world, how in the world are you hiding all this?
So it has been a chore, I'm going to say, to really help people to understand the vaccine and really what's true about it and what's not true. So we do know through really good studies and through data that you're more likely to have fertility issues if you get a COVID-19 infection. And there have been no studies, no linkage between the vaccine and infertility. So that's one thing that we really tried to get out there. So we're just like everyone else. We're picking these things off one at a time.
That's all you can do.
That's all you can do. I still get pushback from people that this is a hoax and this is made up and you can't do it. But ideally, when you see these things on the news of the hospitals overwhelmed and all the deaths throughout the country, it's not a hoax. This is something that we really need to take seriously. And we're showing that the vaccine works. Going back to your point, a great job in the county for our 65 and above being vaccinated, 69%. At our organization, we're looking at herd immunity starting at 75%. So in that isolated part of the population, they're almost at herd immunity. Good for
And
them.
recall, if folks will recall, I'm trying to remember, Clay, correct me, or better not correct me because I'll throw something at you. 92% of the deaths occurred in those who were 60 years or older. We have almost 70% of those folks vaccinated now, and our deaths have held relatively stable. The biggest changes that we have seen up and down have been coming from the state audits. We have been relatively flat, which is a wonderful thing and just goes to prove the effectiveness of the vaccine. So it's, lots of people, they talk about personal choice, and it is a personal choice. If you recall, though, today the headline was Bishop Medley, our own bishop here from the Diocese of Owensboro, said that he considered it an act of charity to get a vaccine, certainly to protect you, but also to protect your mom, your dad, your brothers, your sisters, your grandparents, and those who are around you. That would be number one. And in this community, there was a lot of consternation regarding early on where fetal cells were being injected into people's bodies. And that was debunked quite quickly. I think the only place that fetal cells came into play, and it wasn't any new fetal, it was old line fetal cells, and maybe some testing. But there is no instance of any of that material that's going into your body with these vaccines.
Yeah, that's correct. And I think the thing that the message that we keep trying to share on this is not only is it an act of charity, but it's also in your own self-interest.
Yes.
So I mean, it benefits the individual taking the vaccine as well as those around them, and perhaps the stakes are higher with those that are older or vulnerable, but the risk is higher rather. But yeah, so there's not a whole lot of downside to being vaccinated, but there's a lot better options or safer options for those that have been vaccinated. So
well, let's just put it this way. If 92% of the deaths are in those who are 60 or older, 8% of the deaths are in those who are younger. And I've seen young folks succumb to COVID. And we've even had some folks here who have had COVID, and it wasn't just a case of the flu for a week. It was 4 and 5 and 6 weeks, and in some instances, months and months. And they're still not over it. They're still having issues. And as I started to say, or did say, we're not trying to shame anyone into getting the vaccine. If you have questions, I highly encourage you to talk to somebody who's smarter than me. Talk to Clay, talk to Dr. DuFrayne, talk to your physician. We had OBGYN Dr. Andrea Moore on a couple weeks ago, trying to address some of the issues that younger folks had regarding fertility, or whether or not pregnant women should be vaccinated. And she said unequivocally, absolutely, they should. And in the end, though, said the same thing. If you have concerns, consult your physician. That's the person that is guiding your health, and that's who you should go to when you have a concern for your health. Clay, or Dr. DuFrayne, I've got a question here. Is it still important to get tested for COVID? What if I've already been vaccinated and now I come down with symptoms? Does that mean I don't have to get tested?
So those guidelines are really morphing right now as we speak. So the feeling is, and the guidance from the CDC is, if you've already been vaccinated, then and you start to develop symptoms, it really depends on your situation. But if you're around other people, if you could expose other people, there are some breakthrough cases, people fully vaccinated to get COVID. So if you really have the symptoms, then yes, you should probably be tested. However, let's take it in another direction. So I've been around someone who has COVID. So now do I have to self-quarantine? And I'm fully vaccinated? And that answer is no, you should continue to follow all the guidelines. You should wear a mask, wash your hands, watch your distance. So those are all in evolution, and it does make it a little difficult for people because things are changing through the last year. think about it, things have changed so rapidly and they continue to change as we understand this more and more. So
Clay, you or Dr. DuFrayne, but I'll ask Clay because I called you for some of these statistics last week. So I had somebody holler about why don't you give the number of breakthroughs? In other words, the number of people who get fully vaccinated and then after 2 weeks come down with COVID. And I think I called you up at that time. We had 28,000 vaccinated people in Daviess County, and you had about 20 breakthroughs. And that actually equates to 7/10,000ths of a percent. Think about it, 7/10,000ths of a percent. So if you look at your chances here in Daviess County of having COVID right now, it's 1 in 10, right? We've had 10,000 positive COVID cases. So you get a 1 in 10 chance with no vaccine or a 7/10,000ths chance with the vaccine. I'll tell you what I'm going to do. So what is the CDC? And I think theirs are similar. Actually, they were a little worse than us. They were at 0.008. So, but still much better chances of not getting COVID if you get vaccinated. And then, so I'm going to let you talk about that, Clay.
Sure. Well, of course, I think there was even a report that came out yesterday from CDC that talks about the real world evidence that they're seeing of the mRNA vaccines. We had the clinical trials that they were over 95% effective. I think they're even in the real world setting, they're seeing over 90% effective. So 90 is not 100%. So we expect a small number of breakthrough cases, and we have a process in place where we investigate those and report those on to the CDC. And you're right. I think last time I checked on that, we had investigated about 20 of those for Daviess County, and maybe not all of those met the case definition when we finished, but those those are the number that we had looked into.
And it stuck in my mind. You said, I asked you, Clay, how many of those ended up back in the hospital? You said 2. One of them was because of a fall or whatever, which didn't have anything to do with COVID. So you had 1 out of the 20 that ended up in the hospital. We didn't go any further, but I suspect not as severe a case or reaction as you normally would see. Dr. DuFrayne, that brings up another thing that I've seen on Facebook. We don't have an officially approved vaccine yet. So what are you sticking in our arm?
So what we do have is a vaccine that's approved, that is under investigation, use for it. We're looking to see the approval coming out pretty soon. I think shortly we'll get the full approval. But in the middle of a pandemic, sometimes you do have to take measures that say, we really need to protect the population. We really need to protect all our citizens. So we're going to give you an emergency use authorization while we are working on the formality of giving formal approval. So we're looking for that formal approval shortly. And I'd like to go back and address what you just said about breakthrough infections. So from our side, having the vaccine, from the hospital side, even the breakthrough infections are reinforcing how well the vaccines are working, because only 1 was admitted. And when you look at across the country, all the statistics from the CDC, they've had a number of breakthrough infections, small, but they're really symptomatic patients has gone down significantly, as had the mortality rate, much, much lower than in the unvaccinated population. So yes, you may have a breakthrough infection. It's always possible, but it really helps to keep the symptoms in check, and the serious consequences are much less frequent.
Okay. Just for openness and transparency, I'm not an expert, but we have had other vaccines and other medicines approved for emergency use in the past.
Correct.
And it's not unusual, as you said. One of the things I would say, I forget what the population was, the test population of 30 to 50,000, maybe as many as 100,000. And right now, and I hate to say this because somebody will jump up and say, yeah, see, you use this as a guinea pig, but we've had millions and millions and millions of people who have had the vaccine with minimal, and I repeat, minimal side effects. And it's bearing out what the manufacturers have said these vaccines are 90 to 95% effective. So it's pretty amazing. And to have the other thing, let's talk about, and we've talked about it in the past. I keep hearing mRNA. It's a new process. They've never done. This has been in the works for at least 10 years, Clay. They've been using this type of vaccination or vaccine production for quite some time.
Yeah, so it's not a brand new technology. It's
Right.
I guess it's newer than some of the other methods
Right.
that they use. But there have been other mRNA vaccines that have been developed that they weren't necessarily have to be brought to market because of the things didn't escalate like they did with COVID-19. But no, it's in very promising technology. From the results that we're seeing.
And just again, mRNA works outside of the cell. It doesn't get into the nucleus, so we're not changing the stuff that makes you you. I think, if I'm not mistaken, that nanoparticle is a nano fat particle, meaning it's a very small fat particle that can go through the cell and get into the cytoplasm, the stuff where all the manufacturing takes place. And Pfizer and Moderna use that to deliver the mRNA into the cell. Johnson & Johnson, I think, uses a different technique. They use mRNA to change an adenovirus, the cold virus, or a virus that makes it cold, inactivates it, but then uses it to transport the mRNA into the cell. So again, it's not anything that's going to get into your nucleus and change the stuff that makes you you. Second question that we received: have any of you heard when the vaccine will become available for children younger than the age of 16? I mean, right now we're talking about 18. Is it Pfizer? 16 and under for Pfizer, or 16 and older for Pfizer, and 18 and older for Moderna, right? How about Johnson & Johnson? Is there any place there? Have they said?
Not yet.
Okay, so
I can tell you, so for Pfizer, they just applied for permission to start using it 12 and older.
okay,
So the studies have been completed, and Dr. Stack, our health commissioner in Kentucky, had a webinar yesterday where he was really talking about it, and they're expecting it any time now, that it'll be approved for 12 and older. I have several grandchildren in that age range, and in speaking with my children who asked me about it, should they be vaccinated? And my answer was yes.
okay.
So if you look at the carriers, you look at all the people now who are spreading it, it is younger people within the home. So the only way we're really going to get there is to get everyone vaccinated.
Well, if you remember, the old meme was that everybody stayed well in the summer, but the kids started going to school in the winter, and they started passing the viruses around. It didn't hurt the kids much, but when they brought it home to mom and dad, that's when things
Absolutely.
everything broke loose. Yeah. So just one more question before we go on to something else. Could I say that both of you really strongly encourage people to consider the vaccine? Would that be a true statement?
Yes, for me, that is a true statement. I've been saying that since the day we got vaccines here in Daviess County, which was December 24th. I was vaccinated on December 24th, and strongly support all of us getting vaccinated. Just the way we're going to get through this.
Yeah, I concur fully. I've encouraged my own family to get vaccinated on the first day that they were eligible to, depending on which category they fit in, and so in the strongest terms, I would recommend it to everyone. And like I said earlier, it's not only the best thing for our community, it's the best thing for the individuals getting vaccinated as well.
Yes.
Okay, so what's the easiest way for someone to get vaccinated now? I know that watching Dr. Stack there for the longest time, we were running over each other, trying. All of us old people were showing people just how quick we can be when we need to get a vaccination. Now things have kind of slacked off, and I think last week I was hearing the governor say, Dr. Stack said he had 500,000 doses of vaccine that they needed to get into arms, and people just weren't coming. So what's the easiest way for somebody here in Owensboro and Daviess County to get vaccinated?
Well,
Clay, you started.
yeah, I'm going to say there's lots of providers now. So if you use vaccinefinder.org, that'll allow you to do a quick search by zip code. It'll provide you a list of everyone who has inventory of COVID-19 vaccine. We were saying for a long time that if you were take the first vaccine that is offered to you, don't shop around for the brand of choice. But right now, I think you could do that. I think that you would probably be able to find an appointment in a day or two with whatever product that you wanted to do. Owensboro Health, Dr. DuFrayne can obviously fill it in there. They're awfully convenient. They have lots of appointments that are open. Pharmacies, the health department. Right now, it should not be hard for any individual to find a dose if they want to.
And I
agree
think
with that.
on the screen right now, we've got the vaccine finder up, and there are 44 providers that we found in this area. So Dr. Frame, talk about Owensboro Health. I actually have heard that you guys may be slowing down or changing the way, because when I went out to the hospital to get my vaccine in January and again in February, I mean, it was like a well-oiled machine. And there were lines and tons of people. I have been to the hospital since then, and while there's still a number of people coming to get a vaccine, it didn't seem that as if there were as many. I just wondered if you had found the need to continue to keep that infrastructure in place, or if you had changed it a little bit.
So no changes yet. The only real change is that we've changed the number of days available. We were doing it Monday through Friday, but as the demand really decreased, and we've shortened it down to several days per week. But the same process is still in place. You come in, you go right into the COVID vaccine line. We walk you through the process. You're in and out of the place, in and out of the hospital, probably within 20 minutes. So it does not take long at all. And then going back to your question about how do I schedule a vaccine, if you just Googled Owensboro Health Vaccine, it's the very top line that comes up in the search. And then you click on that and it opens a page. You'll see a green box. You click that box, it takes you right into the schedule. Right now, we're only using Pfizer, but the state is getting back some more Moderna. And we'll start using Johnson & Johnson again soon. And we're going to break up our website that when you go in to schedule it, it'll actually have the 3 choices up there, and you click the choice, and then it'll take you right to the page. And we could probably vaccinate you this week if you went in right now.
Well, I found it interesting. We were going to do a Johnson & Johnson program at the Daviess County Detention Center. And then the little hiccup occurred and we stopped. But now, Clay, I understand that we're doing some Moderna out there, or is it Moderna or Pfizer?
We did some Moderna with the detention center and
55, 56 folks.
That sounds about right. I've seen a couple of dates on the schedule for the detention center, so I know that we're going back as well. And we're at the phase now where we're trying to reach out and provide vaccine where it's needed most. We're happy to work with any partner that can bring us willing arms. We'll get the vaccine to them.
Well, I know last week, during the governor's conference, I said Daviess County would be happy to host a mobile vaccine system if they would provide the stuff that, we'll do whatever we can to help. And I think it's very important that we get out to those folks who, for whatever reason, and we've said, number one, no cost to the vaccine, right?
Right.
And if you don't have insurance, you can bring your insurance card, but if you don't have insurance, don't worry about it. You're not going to be asked to pay. If you need transportation and can't get somebody to take you, you can call Grits, and Grits, just give them a 24-hour notice. They'll take you, they'll wait for you, and they'll bring you home. There's absolutely no reason for anyone who wants the vaccine to go without the vaccine, to fret and worry. I will make this statement right. If you can't get transportation, if you don't know what to do or how to do it, call Daviess County Fiscal Court. You ask for me, and I guarantee you we'll get you set up to get vaccinated. Dr. DuFrayne, do you think, and I ask this because there's a lot of consternation out there. I am 4 months into my vaccine, and this fall, when I get a booster or get another flu shot, am I going to have to get a booster for COVID, or do we know yet?
So we don't absolutely know, but the way this is looking is that we more than likely will need a booster. And it'll end up being just like the flu shot. You come in for your flu shot, you come in for your COVID vaccine booster. It protects you through that year. And so that's the way it's looking, though we're not absolutely certain yet.
Okay. Let's speak to the variants as well. I know there's a lot of concern and everybody talks about it. One of the reasons that you want to get herd immunity as fast as you can is to prevent the formation of the mutations that will cause or change the virus a little bit, and maybe it can slip past your immune system. I haven't seen there are 3 or 4 variants here in Kentucky right now that I've noticed. Very few numbers, but I'm assuming that's because they just don't have the capability to do the genome on a virus that they take out and tell whether it's a variant or not.
So they don't do the sequencing on every sample,
Right.
but they are doing sampling. They take from every positive. They'll take a small percentage and
Right.
do full sequencing, and we are seeing variants in Kentucky, which is expected.
Yes.
The D117 is the one that they predicted would be the dominant variant in the United States, and that's come into fruition.
UK, is that the UK variant?
Okay.
Yeah.
Yep.
And so, but again, the take-home message here is, even though we're concerned about variants, the things that we've been saying to do all along are the same things that will protect us from that. And by controlling the rate of infections in the community, you will take away the opportunity for those variants to take hold, or for new variants to come to light.
And just think about it this way, folks. Every time the virus takes over your cell and has your cell reproduce the virus's self, there's a chance for a little bitty change. So every time, so the more viruses that you have in different bodies out there reproducing, using your cells, by the way, to reproduce, there's a greater chance. Have we seen any of the variants here, or have we done any tests to know that, Dr. DuFrayne?
At the hospital, we have not done any tests
Okay.
to know that. We do know that it's in Kentucky, but we have not gotten to a point yet. So since the 65 and above have really done a great job in vaccinating, our hospital admission rate has dropped dramatically. So we're somewhere between 5 and 10 people at any given time, keeping in mind that our peak was between 50 and 60. So we're attributing that rate to the vaccination rate. So having said that, we don't get the admissions that we were getting before, and we don't see a need yet to test.
Clay, I'm looking right now at the largest groups of people who are testing positive now are that 20 to 29, 30 to 39, and 40 to 49. The older folks, it's not as big. At one time, they were leading.
Mm-hmm.
But now we're seeing younger folks, and I guess it's the case of where when I was younger, I was invincible and nothing was going to happen to me. And I guarantee you, folks, when you get older, and as I said, when, not if, but when you get older, you'll find out that that's not the case. Talk to me, Clay, about some of the things that we have heard here recently. The governor talked about hitting 2.5 million vaccinations in the Commonwealth, and he's going to lift some restrictions. What were those restrictions? How was he going to ease things back?
You know, with a lot of our establishments like restaurants and theaters and these indoor settings, there's capacity restrictions still in place. The lofty goal that Kentucky set was that when we reached 2.5 million people being vaccinated, that all those capacity restrictions will be lifted. You know, we may need to still continue to wear masks when we're in crowds, those type of things until the pandemic is completely over. But I think, you know, we felt that if you reach that point, that would be about 75% of adults being vaccinated within the state, or that we would be in a place where we'd be a lot safer, and there wouldn't be a need for those type of restrictions any longer.
The both shots, 2 weeks passed. My understanding is now if you're outside and everybody's been vaccinated, they don't think it's a requirement that you wear a mask. Although I would say that if you're immunocompromised in any way, I think it would be wise to continue to wear a mask if you had COPD or any such thing like that, being treated for cancer. I think anybody would recommend that you be extra cautious, because you don't need that one more stress on your body. But you know, I think that the state, we are at a crux, and we have to convince and be able to convince younger folks who, again, think they're invincible, that it is an act of charity. They're not doing it for themselves. And why not go ahead and get vaccinated? If it's not going to cost you anything, go ahead and get vaccinated. If you're not going to grow 6 fingers and 12 toes, get vaccinated. If it's not going, we know for an absolute certainty that there are long haulers in COVID, Dr. DuFrayne. I mean, yes. We know that for a certainty. We're seeing that right now inside of a year and 2 months, or 1 month that COVID's been around. We haven't seen a lot of the things that people are saying will happen or could happen that are being hidden. There's just no proof of that.
And that is correct. So we do have the long haulers. We have them here in our community. Interestingly, they tend to be younger. They're frequently not hospitalized. They're 40 years old, 35 years old, have come down with COVID, and we don't know what the triggering mechanism is. The vast majority of people get better. Like you said, 4 weeks later, you're kind of to come back around. But there are these long haulers who have symptoms for months and months, and they're really debilitating symptoms.
You know, it's something just popped in my brain. I wish I meant to ask it before. So you said with the Johnson & Johnson and the blood clots that there was a simultaneous reduction in platelets, right, and blood clot forming. Yeah. And that seems to be an oxymoron, because platelets are needed to form clots.
And one of the theories is the clot is consuming your platelets. Okay. So that's what a clot is. It's just a collection of fibrin, which is a protein, and your platelets. Right. So we think it's a consumption. So,
well, that's the old biology popping back up.
There you go. You still got it.
Well, we're almost 45 minutes in, so I know you guys are busy. Is it safe to travel?
I'm going to say, go ahead, Clay.
Well, I would say if you're vaccinated, you still want to be cautious. You want to do the things that we've been asking everyone to do, using all of our tools. But you know, we're starting to see where we're not recommending people to quarantine after travel now. If you know, I'd say, you know, use good judgment. But if you're vaccinated, you've got a lot safer options than we did before.
Okay. How do you respond? Just one more question, and this is political, of course. How do you respond to those people demanding open up? Open up. When do we get rid of the mask?
Well,
go ahead.
No, go ahead, Dr.
Okay, so my response is, look what's happening in India. Look what's happening in the 3rd and 4th wave in Europe, because they did open up. I know Sweden did this big program where they weren't doing anything. They weren't going to shut down, and early on they thought it was great. And it turns out Sweden got hit harder than every other country around them.
Mhm.
So when you open up prematurely, you greatly increase the risk of a setback, of this coming back. And then we're almost starting out all over again till we get that under control. So once I support, once we get to herd immunity, then you're really going to see us opening up. But
Okay.
prior to that, the risks are just too great.
One of the things that I would say, and I'm gonna pat you and Clay and while it shouldn't be politically correct, I guess, but I'm gonna pat Dr. Stack and the governor and all those folks, community leaders. We have pretty much held the rates steady where we haven't overwhelmed our healthcare system. And if folks remember, that was the goal to begin with. The goal was to make sure that if you got sick, there was a doctor and a room where you could get treated. And we've done a good job of that in our community. We've done a good job of that here in the state. There are other states that did not. They weren't as nimble. They didn't react as quickly. And to your point, Dr. DuFrayne, can you say the word India now? India is just in a world of hurt.
Catastrophe. Catastrophe.
So I have one other question, and it says, is it expected now that younger people will have side effects with the vaccine? I think we talked about that. We really don't know. We're working to make sure that it is safe on children. I assume that they're doing some tests with vaccinated versus non-vaccinated kids. Yeah, running a control.
So I'd like to clarify that a little bit because it does lead to some confusion. So a lot of people will get some side effects from the vaccine. Oh, I got a little headache. I had a little temperature. The next day I felt better. So that is a side effect. And that's not unexpected. And it's very well tolerated, leads to no long-term consequences. I think what people are really concerned about is, if I take the vaccine, what are the long-term consequences? And we can tell you right now, we started the vaccine test last June. So 10 months ago, and to date, no long-term consequences have been identified.
Okay. The other part of that question was, does blood type play a role? And I would say probably not, but I'm not a physician. I'm not a research scientist. So I don't think it's
Play a role in the disease or with
yes,
vaccine?
yes. And
So we are starting to see some evidence that some blood types are more protective than others.
I think I saw O positive, O negative. The O type was a
O
little
type blood. It seems to be a little more protective. We're not talking great differences,
right.
but O seems to be a little more protective than, say, A or B. But that's also true in other conditions.
Yes.
Heart disease, strokes, so it shouldn't be any different with this.
One question that just came to mind. So I get the disease. Early on, there was nothing that you could do. Make me comfortable, make sure that my blood was oxygenated the best. Is there a drug that's becoming available? Or are there drugs being tested? Is there a better treatment today than there was 12 months ago?
Yes. So one, we have remdesivir. We have the monoclonal antibodies that we give in an infusion. When you are first identified, the earlier we give it, the less likely you are to go into a severe form of the disease. And I just happened to read today that Pfizer is working on an oral capsule that they hope to have out by the end of the year that will replace the infusions. So now when you get Tamiflu and you call your doctor's going to, when you get the flu, you're going to call your doctor, and your doctor more than likely is going to prescribe Tamiflu, which is a pill, which shortens the course of the flu and lessens the symptoms. Doesn't make it go away right away. And they're looking at the same thing now for COVID. And hopefully by the end of the year, if everything proceeds the way it is, we actually may have an oral treatment for it.
Okay. Well, with that, I'm going to close her down today and say thanks to our two special guests, although they've become special friends to this forum because they've appeared so many times. But I think you've had most of your questions answered and some of the questions I've had. So Clay, Dr. DuFrayne, thank you guys for being on. I look forward to the day, and don't take this wrong, I look forward to the day where you and I are not going to be sitting in a Zoom meeting talking to people about COVID.
I agree. And I hope that day is in the very near
Very,
future.
very soon. So thank you guys and be safe.